My name is Beth Seaman. I'm 35 years old. I live in Mount Prospect, Illinois. I have a 6-year-old daughter, a 4-year-old daughter, and I have twin sons who are 8 months. After Amelia was born, I felt great. Everything was normal, and then I started to try to lose some weight and exercise and to get back into shape. I had been taking a kickboxing class, and I thought that possibly I had strained something, and I had just tremendous pain in my back and in my side and my hip. And I felt that it was going to go away on its own, and I waited for 3 months before it did, and it never subsided. It just kind of, it continued to be there and even to get worse. As an accountant, most of what I do is go to meetings and sit at my desk, and I had considerable pain while I sat. I would need to get up and walk around quite a bit. It was hard for me to sit in meetings and to even focus on what people were saying, because at a certain point, all you can think about is the pain. And finally, I decided that there must be something else that can be done. So I went and visited just my regular internist. And they took x-rays and isolated that I did not have a fracture, and sent me on my way to physical therapy. A couple months later, I was still struggling with the pain, and I was having trouble accepting that I was going to continue to be like this. It was affecting my personal life. I felt like I couldn't spend time with my kids and play with them in the way that I wanted to. I couldn't sit on the floor and play with my girls. All I could think about every day was that I was in pain, and that I couldn't think about my outlook for the future wasn't very good. I couldn't think about doing normal things, like I couldn't think about having another child because my body couldn't take it. And so it was just out of the question. Then actually at a Halloween party that we host every year, a friend of mine, she mentioned to me, "I hear you have back pain." And we talked about it, and she said, "Oh, I do too." And I saw this doctor at RIC who specializes in women's health issues and musculoskeletal problems. And so at that point I thought, well, I don't know. I kind of hem and hawed over the decision whether to see Dr. Fitzgerald. And then I finally decided. I made an appointment right before Christmas time, I remember. So I saw her on January 2nd of 2006. Okay. Well, she did a normal exam and talked to me about my problems and what I was feeling. And she confirmed to me, she said, you know, these things that you have aren't normal, and that you don't really have a diagnosis. And she reviewed my records, and she said, you don't have to learn to live with this. You can get better. Mm-hmm. So, and that was the first time in, I think, about 6 months that I had felt any hope at all that my life could get, I could return back to normal. About a month after I saw Dr. Fitzgerald, I was starting therapy, and she was great. Her philosophy was, I'm going to teach you the skills and what you need to know in order to fix your own body. Great. I attended therapy at RIC for 3.5 months. And at the beginning, I attended once a week, and then I attended once every 2 weeks, once every 3 weeks, just to sort of taper off. And I'd say about halfway through therapy, I was going through and living my life without really any pain. I was feeling great. I felt back to normal, and I was amazed in such a short period of time. And the trick was really just finding someone that knew what the problem was and knew exactly, what to do. I was able to kind of forget about the pain and continue to live my life, go back to living my life actually, spending time with my kids and going out to dinner with friends and doing social activities, going to a little dance class with my younger daughter, all these things that I couldn't do before. So I sort of forgot about all my limitations, and was just able to think about things like normal people do, which is, for us was whether or not we wanted to have another child. And I did talk to my therapist about it, and she had indicated that, it wasn't a problem for my back, that my back was gonna hold up and not to be afraid. And so we decided to try to have another child, and got two. I had twins. people all the time. I give out Dr. Fitzgerald's name to everybody. Any woman who tells me that they have back problem, and a lot of women tell me, I have back problems, I have pain, and I don't have an answer. They have doctors, just like I did, have well-meaning physicians tell them that they just have to learn to live with it. And I tell everybody about Dr. Fitzgerald and RIC and what they did. It's just most amazing is that I did feel like I had my life back, that before I didn't. I wasn't living. And then after coming to RIC, I was able to be myself.